Hi, my name is Jessica Belcher, and I am here to talk about the ADDIE model, which will be applied to using UNCG nursing students and Brookdale Assisted Living. I actually had a job interview yesterday with the School of Nursing to become the simulation technologist, and this fits right along with this course that I'm taking right now. And so the project that I'm working on for this course is a VR scenario that will take the UNCG nursing students to a nursing home, Brookdale Assisted Living, because I've been in nursing homes since 1999, like on and off doing stuff. And I thought it would be really unique to set this up. And yesterday, they told me some of the items that you see on my screen that they already have, and so we'll talk about that in a minute. So I'm going to be using the ADDIE model. The first is analysis, and this actually we're going to analyze the nursing students' assisted living scenarios to provide valuable experience and understanding of geriatric care, how to communicate with these types of patients, and patient safety. Using constructivist learning theory, students actively engage in decision making while working with simulated residents. It could be with VR or in the sim lab. In the assisted living environment, this approach allows them to build knowledge through realistic practices and reflect on how they did. Then we're going to actually design the program. D is for design. The simulation would replicate an assisted living setting, complete with residence rooms, social spaces, clinical interaction areas, medicine areas, a dining room, and all of those different things that an assisted living place has. Nursing students could practice skills such as medication administration, mobility assistance, therapeutic communication, taking them to the bathroom, bathing them, also helping them with things that happen in their life. Sometimes they have dementia, or sometimes they lash out or have feelings of loneliness. So in the design, I want them to learn more empathy of how to take care of some of these elderly patients. So a lot of scenarios will need to be created. They're going to branch out the scenarios and include challenges for the learners with real world concepts and decision points on if you have a patient that you're taking to the bathroom and then another one next door screams out in help because they're in pain. What are you going to do next, right? So you need to learn how to respond quickly, and which one are you going to respond to first. They also need to learn how to respond to a fall or address a resident's emotional needs, and reflect and debrief. So in the interview yesterday, I was also taken into the simulation lab. There's 2 floors for that at UNCG School of Nursing, and they have many debriefing rooms. Some are small and some are larger. So after the simulation scenarios in these clinical settings that they've set up with the actual mannequins, they then show the recorded video because every one of the simulations are recorded. But my project here would be a little bit different because it would be virtual reality. So virtual reality is just like those goggles down on the bottom corner of your screen, and the girl is watching those. So you can design it either way. Development, the simulation could be developed using tools like anatomy, high fidelity mannequins like lateral, and role playing. It also can be used using some type of Sims creator where you can actually create the patient yourself and use a computerized sim type person, and just you can actually build your own nursing home and then build your person and then set them up in different areas. The resident profiles will be designed to represent common health concerns in assisted living such as dementia, cardiovascular disease, or diabetes. This ensures the students will face a wide range of realistic scenarios and mirror the challenges that will happen in real life, because let me tell you, just like I told them yesterday in the interview, not everything happens that's in the textbook will happen. Some things will happen that's not even in the textbook and you never even learned it. So this way they can see some things that maybe they've never seen before. Implementation is similar to what you see in the pictures here. The Brookdale simulation could be integrated into the UNCG nursing curriculum as a supplement to the coursework. They already have some things that they use in SimLab to help with clinical hours, but this could add to their curricula for their geriatrics and long-term care. Students would complete pre-work and then participate in the simulation and then do a debriefing afterwards. The pre-work is maybe a Canvas module or something that's leading up to it. This helps them with their experiences to strengthen their judgment, empathy, and problem-solving skills to prepare them to deliver high-quality care in the assisted living environments. The evaluation is the E in ADDIE. The simulation effectiveness would measure through the both formative and summative assessments. Feedback from the students and instructors would guide improvements, while students' performance on care planning, communication, and safety would be measurable. Resident satisfaction scenarios are the quality of life indicators. So on my sim game, virtual reality, there would be lives on the patient, just like in a Mario game, where you see that you have 9 lives or 2 lives or whatever. In the actual little video game in simulation VR, your patients, you can see what percentage of life that they have, whether or not you made a good choice or a bad choice. And so this way they can see all the different outcomes and scenarios from a assisted living. So the key takeaways for this model is to reinforce the power of simulation, virtual reality. I did learn yesterday that UNCG has 50 virtual reality simulators, 2 adult, 1 obstetric, 2 infant, that kind of thing as well, as far as the mannequins go. And by designing a Brookdale Assisted Living simulation, the nursing students at UNCG can practice vital skills in a safe yet authentic environment by building their confidence and competence. Now, it is very important that these students realize they can make mistakes on simulation, and it is okay. Making mistakes is a part of life, and you cannot learn unless you make a mistake. So making mistakes on a sim mannequin or a VR simulation is perfectly fine, and I want you to do that. The reason being is if we make a mistake on that, we can hit the reset button and start over. And if you learn by the mistakes, right, then you can see it on the video and the debriefing and say, oh, I should have done this better. So in real life, if you give them the wrong medication or have surgery on the wrong body part, there are consequences. So therefore, if you make the mistake now instead of making it later, then it's better for you to learn from your mistakes now. So this actual simulation not only prepares students for immediate clinical practice, but also implies and inspires empathy and creativity in caring for older adults. So today I've described to you about using the ADDIE model and applied it to UNCG nursing students with the Brookdale Assisted Living. Thank you.